Hi, I'm Dr. Pranav Reddy. I'm the aesthetic plastic surgeon, and I just wanted to give you a little video about Botox today. So, what is Botox? People have this fear associated with it, a lot of interest associated with it as well. But Botox is a completely painless, completely quick, and a brilliant way to treat your wrinkles. So, let's dive deeper into Botox.
Doctor, explain why Botox and how safe it is, the science behind it.
Sure, yeah, great question. So, Botox is a neurotoxin. Neuro working on the nerves that feed the muscles, toxin, wherein it works to break down that connect, and hence it reduces the contraction or the twitching of the muscle. So, all your muscles in the face usually are impacted into the skin itself, which is why whenever you smile, you raise your forehead lines, all of it causes wrinkles everywhere, right? So when these muscles are hyperactive or normally active, you develop wrinkles all over the face. So what Botox does is it works directly on the muscles. So the injection is given with a very small fine needle into the muscle directly at multiple points depending on what muscle we're trying to treat, because your face has thousands of muscles, hundreds of muscles. So when this injection is given into the muscle, it paralyzes it for a short period of time, because we give very controlled dosages of Botox, and this takes effect within a few days and lasts for a few months.
When do we start seeing the results, doctor?
Right? Again, Botox doesn't start immediately. It takes a few days for it to start working. We say ideally Botox gives you results anywhere between 5 and 7 days or so, and your results last for quite a while.
And what are the side effects?
So, Botox usually doesn't have too many side effects. We apply a numbing cream for people who are overtly sensitive to pain, so that even that doesn't exist while we're doing the injection. Maximum you'll have is a little few red bumps all over where we've given that injection. That soothes out within a couple of days or so. And some people develop a slight amount of headache, lasts a day or so, pop a dolo, and most of the time you should be completely fine.
How often do we need to get it done and how long will the results last?
Right, great question. I think this is the biggest fear or doubt when it comes to Botox, right? People think it finishes so quickly. Why would you keep on taking the injection? It's not worth the effort when you're taking Botox. But what you have to understand is you're paralyzing a very, very active muscle in your body. Your face is constantly working. You are talking to people, smiling, crying, having a conversation, and all these muscles are working literally to see, breathe, and talk as well, and chew. So when you paralyze these muscles, it usually lasts for 3 to 6 months, depending on how active these muscles are or how actively the Botox works. A small dosage of Botox goes away rather quickly. A larger dosage of Botox, within limitation again, works for around 4 to 6 months. So usually you need top-ups every 6 months or so.
What precautions do we need to take after the procedure?
Right. Again, very important question. So when you have Botox done for you, the one thing that you should absolutely know is don't massage that area immediately after or for at least a period of 6 to 8 hours, ideally a day after the procedure. Because the more you massage it in, the more you're pushing Botox away from the particular area where we want that Botox to work. So try not to massage the area at least for a day, right? The other thing is the general conditions of avoiding alcohol and smoking, at least for a day from surgery. It's not that you're on any medication, but it's just to give your body the ideal scenario for our injection to work.
Doctor, what is the ideal age for Botox?
Today's question is always about how early can we start Botox. In 10 years ago, 15 years ago, 20 years ago, people would probably get Botox in their 40s, 50s, 60s once the wrinkles started appearing all over your face. Botox now is preventative, right? They always say in medicine, prevention is better than cure. Botox is not the cure alone, it is a prevention as well. You've heard of baby Botox, you've heard of small dosage Botox or micro Botox. Now we give all of these injections to people even in their late 20s, their early 30s. Small dosages of Botox to prevent fine lines from happening, to prevent wrinkles from forming, so that you don't look like you are 60 when you are 40. You don't look like you're 80 when you're 60. We can age you backwards earlier when you start taking care of yourself even earlier. And one thing I wanted to say about Botox is it is a very quick procedure. You can walk in, have a consultation with us, get the Botox done, and be out of our clinic in less than half an hour. So if you want to do this early in the morning before you go to work, if you want to do this in your lunch break after you've had your lunch, if you want to do this in the evening on your way back from work, any of those scenarios are perfectly viable for you to get it done. And the one thing I want to say is anything that we do here, everything that we do here is not just about making you look better. The reason we want to make you look better is so that you can feel better as well.